All right, welcome back to the Elias Macko Show. Now, tomorrow, I'm taking my kid, Wolfgang, our child. We're taking him for his first vaccinations tomorrow. 8 weeks is when you get the first vaccinations. With that in mind, let's talk about vaccination. Let's talk about the measles outbreak in Canada. Quebec is at the epicenter of the outbreak. 7 of the province's 10 cases are in the Montreal area. On top of that, the highly contagious disease is making a comeback years after it was eliminated. Let's find out more. Paul Guerrier joins us, responsible for medical immunization and vaccine preventable diseases, on the line at Montreal Public Health. Hi, Dr. Guerrier. Welcome to the show.
Good morning. How are you?
I'm doing well. So, listen, when you hear that measles is making a comeback, a whole bunch of stuff goes through my mind. What goes through your mind when you hear it?
Well, this is unfortunate that this disease is coming back because, as you said, it's a very highly infectious disease, and it can be prevented by 2 doses of vaccine. So that's one of my main messages this morning is to make sure that people check their vaccination booklet if they still have it. Make sure they're vaccinated. If not, go and see the doctor or take an appointment to get vaccinated.
Okay, so this relates to me because I don't have my vaccination booklet. I imagine I got vaccinated when I was growing up. I didn't have vaccine-hesitant parents or anything like that, but I don't know. What do you do if you just don't know if you've been vaccinated?
Well, several things. First, if you were born before 1970, we presume that since the virus circulated in the areas of Quebec and Montreal during those years, that you're fully protected, you're immunized. You probably got it when you were a kid. After 1970, you need 1 dose. If you're born between 1970 and 1980, you still need 1 dose. And after 1980, when vaccination became very common, now you need to have 2 doses. Of course, certain people who work in healthcare professions, for example, always need 2 doses. So if you're not sure, check with your doctors, and you can just get it again. There's no problem of getting the vaccine again, 2 doses, and you'll be fully protected.
So why is measles so contagious?
Well, it's a disease that transmits, first of all, by air. It is very, very contagious. It's because it's the virus. That's the way it is. It's also transmitted by droplets. For example, if there were 10 people in the room that had never been exposed to the virus, had never gotten the vaccine, around 9 and perhaps all 10 will get the disease. It's a very highly contagious disease. So there's a 90% attack rate. So, and also the other problem is that a lot of the people are contagious a day or two before, usually a day before they start developing symptoms, before they get this rash. So it's highly contagious.
Is it making a comeback because we dropped the ball? When I say we, collectively, many of us have just stopped getting some vaccines that we need?
It's part of the answer. There's also vaccine fatigue because of all the vaccines we got during the pandemic. Mm-hmm. It's also because it's a disease that we haven't seen lately, and we don't take it seriously, perhaps. But now we do have to take it seriously. There are increases all over the world, in the States, in Asia, in Europe. And one of the big things is that we're trying to maintain an eradication status since many years. Montreal, Quebec hasn't had any transmission in the province. We do have a few cases every year that come from travelers who are not adequately vaccinated, who get the disease while they're on travel and bring it back here. And that's one of our main concerns now, is that since it's very prevalent in many countries right now, many outbreaks in many countries, and now it's going to be the start of traveling outside of the province. There's the school holidays right now. In spring and summer are coming, people are going to travel. They may get it outside of Canada and bring it back in. So before you leave on a holiday, check your vaccination booklet. If you're not sure, get yourself vaccinated.
And Dr. Guerrier, for our parents that are listening, and obviously they're concerned about their children as well. Maybe they're concerned about themselves too. To get this vaccine, where do you go? How do you get a vaccine? How easy is it?
All right. Well, we do have lots of this vaccine, so you need to see your doctor or take an appointment with Click Santé or see your pediatrician, or even call the CLSC. And the vaccine is free. It's part of the provincial immunization program. Most children get it at 12 and 18 months. And so, check your booklets, check your children's booklets, and take those appointments, see your doctor, check the CLSC, Click Santé, and should be able to get an appointment.
Doctor, that's all the time we have. Thanks so much for joining us.
You're welcome. Have a good day.
You too. That is Dr. Paul Guerrier, and he's responsible for medical immunization and vaccine preventable diseases at Montreal Public Health.